Okay, good afternoon, and this is Audrey Russo, and I'm the President and CEO of the Pittsburgh Technology Council, and I am thrilled to be here on another Business as Usual. And with me is Jonathan Kirsting. He's Vice President of Visibility at the Tech Council, as well as my co-host in this and in Tech Vibe Radio and many other things. So just a few things about today's call as we start to let people in. It wouldn't have been possible without the strong support of our good friends at Huntington Bank, who have stepped up to sponsor this series. And if you don't know about Huntington Bank, they're actually the largest SBA lender here in southwestern Pennsylvania, and they have been very, very busy supporting many of our local companies. I also want to give a thanks to the team at AT&T for their support for all of our public policy series, and more importantly, for their support that they provide to the broader community during this pandemic. They have even, as of last week, announced a $5.5 million donation to Feeding America, which in part benefits the Greater Pittsburgh Community Food Bank, and they have also sponsored 412 Food Rescue. So as a quick programming note, tomorrow we have a special 1-hour edition of Business as Usual. We are excited to be hosting Dr. Rachel Levine, Secretary of the Pennsylvania Department of Health, who will be joined by Secretary Dennis Davin from the Department of Community and Economic Development. And then at 12:30 on Friday, same show on Friday, we have a special guest, Senator Bob Casey, who will update us on the federal government's current stimulus plans. So a little bit about the tech today on the call. If you haven't been on the call before, we've muted all of you so that we can make sure that we can clearly hear our guest. And we also have a chat. If you see that at the bottom of your screen, you will be able to ask questions. Just say who you are, what company you're with, and we'll work hard to try to get some of these questions answered. We are recording today's session as we do all others. So please, if we can't answer your questions, we'll try to answer them at a later date and put them out on our website. The other thing is, this is not an opportunity for you to advertise. That's not what today is, so do not use the chat box for that. So quickly, I would like to bring on today's guest, Leslie Davis. She's Senior Vice President and Chief Operating Officer for UPMC Health System. She oversees a lot, all of the hospitals and practitioners, et cetera, and I am thrilled that she is here today. So welcome, Leslie, and thank you for being here.
Thank you, Audrey. I'm delighted.
We are going to jump into a couple of questions. So as we welcome you to the program, can you start out by providing us with a high-level overview of how UPMC has responded to COVID-19? How did you respond to it initially, and how has that response sort of changed over time? And how is it changing even right now? So thank you again for joining us.
Thank you. A lot of questions to unpack. Hi, everyone. And I'm really delighted to be here. And I was learning a little bit about your group from Audrey and Jonathan and Brian, and I'm really, really delighted to be here. From the start, UPMC gathered data from many, many sources, and we were able to guide our decisions. In early January, before much of the world was even aware of this emerging virus, and before the disease even had its proper name, we had a travel and symptom screening policy in place at UPMC. We've dealt with other issues in our world and in our community over the past many years, such as Ebola and H1N1, and then, of course, just our normal screening for the flu virus makes us very sensitive to the issues of these types of contagious diseases. So we try to let science and data gathered through testing, as well as our public health guidance, direct our decision making. As an academic medical center, and I would say a world-class medical center, UPMC provides outstanding patient care. We conduct research to continue to improve medical care, and this combined experience is what uniquely prepares us to deal with these kinds of challenges that occur from time to time. So we immediately, as soon as we realized that this was spreading to our country, we watched what went on in Wuhan and Milan. We have many scientists who communicate with their colleagues abroad. You may know that we have international hospitals as well. So we had boots on the ground, certainly in Palermo and many parts of Rome, and we were able to watch this as it unfolded. The disease, as it hit first in Seattle and then certainly the hot spot in New York, we weren't quite sure what would happen in our region. And so our preparedness is always, I would say, a very strong suit of UPMC's. We had teams that were mobilized and ready to deal with any kind of emergency preparedness. So for instance, I'm sure this group would be very interested in our IT work. Mm-hmm. I know Ed McAllister is part of your group, and his group was well prepared years before to have many of our workforce, much of our workforce, being able to access important things from home, as well as our patients, as well as our tools like My UPMC, where our consumers and our patients can access their physicians. The ramp up in telemedicine was incredible. Mm-hmm. I think we did more telemedicine virtual visits in 2 days than we had done in the prior year before. Our facilities team was able to find alternative care sites for our patients. And so these are just, some examples. Our supply chain was already sourcing masks and gowns and N95s and all these things that many of our community have learned, all of these buzzwords around infection and taking care of patients with infectious disease. PPE, which is another buzzword, protective equipment, and all of the things that we've been talking about. So this is kind of what we are. This is what we are as a group of hospitals and an academic medical center. We have 90,000 employees. We have 40 hospitals. We have an insurance division, and we all came together to be as prepared as possible for COVID-19 at UPMC.
So has anything changed over these last few weeks at all, like in terms of population changes or any of the cases? Is there anything?
Oh, sure. I mean, there's, I can maybe just take a few minutes and walk you through what is going on overall, and you can get a sense of how we do stack up compared to some of these other areas. And that is right now, across our 5,500 beds, and that's from Western PA all the way across the state. We have a small hospital in New York, you may know that. The Western Maryland Health System is part of our portfolio as well. So across these beds, only 2% of our beds are occupied right now with COVID-19 positive patients. 8% of our ICU beds are COVID positive patients, and only 7% of our total network of ventilators are being used by COVID-19 patients. So as you can see, fortunately, we have a lot of capacity. We're very grateful that our community is safe and the virus has not spread to Western Pennsylvania or really to Central Pennsylvania. Philadelphia appears to have a little more of a hub or a hotspot than we have out here, but they, from my conversations with many of the leaders and the CEOs in those hospitals, they are handling this very, very well. So we believe that we are on the other side of what many experts have predicted to be our worst week. The very high surge that UPMC carefully prepared for simply has not happened. So we do remain very vigilant. We are watching those data daily. We know where patients are being admitted. We know we're caring for many COVID positive patients in our communities, and they are not fortunately sick enough to require hospitalization. They're able to stay home. And as Dr. Levine says, stay calm and stay safe. We have enough masks and gowns and gloves and N95s and equipment to make sure that our staff is safe, that our employees are safe. These are our frontline workers, the folks that come in every single day, not knowing what to expect, and they are truly, truly, truly heroes. So that's what's going on in terms of the caseload. I'm sorry, Audrey, were you going to ask me something?
In terms of, I just want to just piggyback on that, and then we'll go into a couple of questions that from our group here. In terms of flattening the curve, and is that where we're at right now? Are we flattening the curve? And what do you see in terms of the future as it relates to speculation of a second wave? People are talking about that hitting in the fall. So it's a two-part question.
Yeah. So let me cover a little bit on the first one, the flattening of the curve. We do believe that between the differences in geography in this region, we spoke earlier about population density being an important factor. Certainly the social distancing and the fact that we are keeping our vulnerable populations safe to the extent that we can. We do believe that we're on the other side of this. We are also at UPMC answering the call for more testing capabilities. And that's when we really know what's going on. We're not working blindly. We're able to tell who is positive. These are the different words, positive symptomatic. So those are the symptoms of COVID-19, or possibly positive asymptomatic, meaning someone may actually have the disease but not be showing those symptoms. And that's a very important part of the testing, so we know who is sick and who should be isolated and who shouldn't be. We've developed our own in-house test. We did this in March, and we've stood up this testing as well as collecting specimens in most of our hospitals and most of our communities to make it as easy as possible for our communities and for our patients to be tested. We've also worked really hard, both with our government officials as well as internally, to create the right supplies and build our supply chains so that we could have things as simple as nasal swabs. I mean, who would have thought that there would be a shortage on that? And we've been able to actually create them internally with some of our innovative radiologists and 3D printing, where we have now thousands of these and we can roll out testing more broadly. We're also trialing many innovative therapy solutions, as well as working on a vaccine. And I say all this because when you ask the question about wave 2 and what we hear about wave 3, I mean, we're not really sure, except to say that if this does respond like other coronaviruses and other flus, this will start to just sort of drift away as the humidity changes. But we could see this return sometime in the fall as the weather changes again. And that's why it's very important that we understand what part of our workforce and what part of our patient population is infected, as well as having really treatments. And I think that's part of the reason that we were so frightened as a society when this rolled out to across the world initially.
Okay. So thank you for that. Jonathan, we have a bunch of questions here from our audience. If you could
Excellent.
start to ask some of them, that would be awesome.
There are so many, and I'm always appreciative because we have the smartest people on this webcast. And thank you so much, Leslie, for hanging out with us today. So first and foremost, someone wants to know here, has UPMC collaborated with Highmark at any point in this as part of the preparedness? And if so, how did that collaboration go?
Yeah, so UPMC has been collaborating with everyone. We, as a group of healthcare providers, share the mission of taking care of all of our patients. And there are many, many forms of collaboration between our hospitals, our chief medical officers, our chief nursing officers, the Hospital Association of Pennsylvania. We're all collaborating.
Good. Okay. Next question, Jonathan.
So people are really curious about, will there be a time when people will be able to be tested without having a prescription?
I don't know. We are, obviously continuing to track the supplies and the ability to do that. But again, this is my my non-clinical answer is I would say absolutely that will happen. And my guess is over time, there may be easier ways to test. We're reading about point of care and evaluating all of the different technology as it exists today. So again, we just keep tracking things related to what is most important. And right now, it feels like it's most important to ensure that our community can get its necessary care. And in order to get necessary care, we are testing those people who will be coming to UPMC for a surgical procedure so they can be assured that they're not carrying the disease and that our healthcare providers can stay safe as well.
Okay. Is there time for one? We have one more question, Jonathan.
There's so many, we can't get to them all. Here's actually a really quick, interesting one. Is UPMC participating in the CMU Facebook initiative and gathering data?
Could you ask that again? I missed the first line.
Is UPMC participating in the CMU Facebook initiative that's currently gathering COVID data?
I don't know. I really don't know. I know that we are collaborating and participating with everyone, and certainly around immunity and all of the treatment aspects, and eventually a vaccine. So I'm guessing that we are, but I'm not sure.
Gotcha, no worries.
I'm just happy to be on Zoom. I'm not sure about that. So I'm so excited. This is amazing. My kids will be so proud of me.
Earlier this week, we hosted Dr. Louis Falo over at the Department of Dermatology. He was working with a team of scientists with Pitt and UPMC to develop the vaccine. So can you talk about your team's role in this work?
Well, my team we're all on the same team. So Dr. Falo talked to you about the skin, I'm sure. And then this thing that looks like a Band-Aid with 1,000 little tiny microneedles. And we are supporting we have been supporting his work over the many years. And now obviously we're accelerating it.
Okay. So Jonathan, why don't we jump to another question?
Yeah, absolutely. What is UPMC's strategy to increase flu shots in 2020 and keep hospital beds open for COVID patients?
You mean regular flu, the traditional flu shot?
Exactly. Yeah, I think that's what
we've been doing that for years. And so I actually think it won't be hard in the future. I think it'll be a lot easier to convince people that they need a flu shot, but we're kind of past all that. I mean, our employees get their flu shots, our physicians get their flu shots. So I think most of the controversy around flu shots were many, many years ago. And I think anyone, and this is not necessarily healthcare workers, but I have spoken with many people in the community when this first started, and they said to me, is it too late to get a flu shot? And should I have a flu shot, even though there's not a COVID shot yet? And we had encouraged all of our community to make sure that they had flu shots. By the way, the flu, I think the new number that just came out is something like in the US, there have been 65,000 deaths from the flu, from influenza. And, we don't go home at night and see that flashing on the screen, how many deaths there are in Pennsylvania, but the flu is quite dangerous to many, many parts of our population. And we've been caring for flu patients for years. So far, COVID-19 has not gotten anywhere close to that number. I hope it doesn't. And even if it did, we're still, and that is without any treatment. We still have Tamiflu, which is not perfect. And we have flu vaccines, which are not perfect. So we're encouraged that we will have treatments and ultimately cures for COVID-19 as well.
Jonathan, there's another question in there about long-term care.
Yeah, from Courtney Williamson. I can't get to the exact question, but she has some concerns about what is UPMC playing a role with long-term care facilities and helping them manage. It seems like they've been mostly impacted here in Western Pennsylvania. Yeah,
thank you, whoever asked that question. Most of the patients that are being transferred into UPMC hospitals, both in Western Pennsylvania and in Central Pennsylvania, over the last couple of weeks, have been from long-term care facilities. Fortunately, not any UPMC facilities, although none of us are immune to this. But again, we did very early screening, very early lockdown procedures, limiting of visitors, which I think has helped to prevent the spread in the long-term care facilities. And we stand ready to help in whatever way we can. Many of our physicians work in the long-term care facilities, and we've been providing a lot of advice and care behind the scenes. But that's certainly an opportunity, I think, for all of us to look at in the future.
So there's another question, and then I'm going to get on to a question. Is it accurate that UPMC hospitals are testing patients for COVID-19 prior to entry actually into the hospitals? And how much do people need to be prepared for that? How is there a process for that?
Yes. So we announced at our press conference, I think it was yesterday, these are such long days.
I know, right?
That we would start testing all patients who were undergoing a surgical procedure at UPMC hospitals. And that happens during the preoperative workup of a patient.
Okay. And then obviously you've curtailed visitors, right? In terms of your process.
So we've curtailed visitors. We have screeners at every door at each of our hospitals. We are taking temperature through there's a technical term for it, but you basically don't touch the forehead with a thermometer. We ask a series of questions. We provide a mask, and that's for anyone that's coming in for a service, as well as our employees each and every day.
So, listen, the nature of this pandemic has taken a toll on the patient community, our economy, but also on the teams that are treating patients and the family members who need to remain socially distanced from their loved ones as they're being treated. How is your team holding up? I mean, you're overseeing a vast network of providers and leaders, from physicians to LPNs. How are you holding up, and what can we do in our community, our tech community, be helpful to you?
That's very nice. I think, first of all, I want to say that all of Pennsylvania, I mean, it's a great Commonwealth. And people have been incredibly supportive, neighbors and friends and community and patients to all of our teams. And I think in general, our UPMC employees feel incredibly proud to be part of such a great organization and to have the opportunity to do such mission critical work. That's what we do. That's why we get up and come to work every day. And we are very proud. And I myself, I don't have the privilege of taking care of patients. I'd probably be terrible at it. But I can take care of other people who take care of our patients. And, you know, in the almost 30 years that I've been at this, I have never felt more proud of the work that I am privileged to do. So, you know, we're trying to help our patients feel very connected to their families through social media, through Facebook, through Zoom, through streaming. Many of our nurses have brought in iPads and laptops, and most of our patients, almost everyone has a phone these days. So we're able to FaceTime and make sure that families are very connected. We are physically rounding more in our hospitals. Our leaders are rounding. They're coming in on weekends. They're supporting their teams and patients. So I think the level of engagement in general is even higher than it's ever been before.
So my comment about wanting to help is that we actually do. So many of us who are sitting on the sidelines are feeling a little helpless, and we're cheering you on. So if there really is a way for us to be helpful, we'll circle back, you know, I'll circle back with you, but that people want to help. And I'm sure that you can feel that.
I know they do. The donations we've received of masks and booties and, you know, food. Clinical people love food, so we don't stop eating. But we probably need to figure something else out. You know, I don't know, maybe food donations. I mean, we can figure something out for our frontline workers. So
okay.
Well,
that's great. Listen, I cannot thank you enough for, first of all, taking 30 minutes out of your hectic day and for your leadership. Really appreciate sort of a little bit of an inside view. You can tell we have a strong community here, particularly in tech and innovation. And, you know, we want to support your efforts, and hopefully that we are on the downside of this for now. We hope that, and we are glad that everyone's safe, and you as well. So I want to thank you for that. And so thank everyone for being here today. I want to thank AT&T, Huntington for their continued support of ours. And then just remember that tomorrow we actually have a packed show. As I mentioned, Dr. Rachel Levine will be joining us, as well as the head of Department of Community and Economic Development, as well as Senator Bob Casey. So thank you, Leslie. Thank you, everyone. Thank you, Jonathan. And we'll see everyone tomorrow.
Thank you, guys.